There are many types of headaches, and while not all headaches are the same, they all share one thing in common: pain. And if you suffer from migraines, you know how painful and debilitating they can be. So what are some treatment options? Here with some answers is my personal doctor who has helped me overcome my migraines, Dr. Brian Loftus of Bel Air Neurology over in Houston. And we appreciate you being here. So as far as migraines, what are some triggers that may help you find out that you do have migraines?
The most frequent triggers we can't do much about is menstrual cycles and weather fronts, being sleep deprived, skipping meals. Maybe the skipping meals people can try to do a little bit better
More
with, but it's kind of hard to control your lifestyle sometimes.
Yeah, and what about caffeine? Is that a biggie as well?
So if your headaches are frequent, I like everyone to stop all caffeine, chocolate, diet drinks in case the aspartame is a problem for them, at least for a few weeks, to see if that makes an impact.
Now, isn't chocolate a good thing? It's supposed to be good for you.
Makes people like happy, but it's not very good for migraines. And if stopping caffeine makes things worse, then you really need to stop. So those are the folks that if they can get through about 3 or 4 really bad days, they'll be better on the other side.
Now, as far as stopping caffeine, can't that also create headaches, caffeine withdrawal?
Yeah, so people who sort of have a caffeine withdrawal headache really have to stop because they're constantly in withdrawal. Every night you go to bed, you withdraw overnight. And my rule of thumb is a 6-pack of caffeine a day. Starbucks counts for 2 apiece.
Ooh.
Okay, those people probably ought to stop, and they'll be fine by half the time. That'll solve all their headache problems. They don't have to come back and see me.
Now, as far as medication goes, I know that there are a lot of over-the-counter medication when it comes to migraines. And a lot of those medications have caffeine in them.
Correct.
Is that necessarily a good thing?
No, not really. So if you're just taking your Excedrin migraine or something like that once a week or less, then you're fine. You don't have rebound. But if you find that 10 days a month you're taking some caffeine-containing product to try to treat your headache, whether that's Excedrin migraine or Starbucks with 2 Advil, okay, then that's a problem, and that could be leading you to have more and more. You are in a medication overuse rebound cycle. So
when is it time to go to the doctor?
I think if your headaches are once a week or more, or even if they're just disabling occasionally, they're very good treatments for when they're just on rare use. But when they are once a week or more, then you probably need to be on a preventative. And the better ones are ones that only doctors can prescribe.
Now, as far as preventatives go, what are we talking as far as preventatives?
So the most common one are some of the seizure meds. We have those that gain weight, those that lose weight. We have
women like the ones that lose weight.
A lot more than the ones that gain weight.
Yes.
That is true. Then we have some antidepressants, both those that we really don't use as an antidepressant, but those that are well approved for anxiety and depression as well. We have some blood pressure medications that are good for migraine.
And Botox is also another one?
Botox is FDA approved for what's called chronic migraine. Those are for folks who have 15 out of every 30 days with a headache, at least 8 of them being severe each month, and that's a very good treatment, although it's quite expensive.
And I know lots of our viewers have some questions about migraines, and we will get to those next week when you come back and we answer more questions about migraines. Dr. Loftus, thanks for stopping by.